People get tested for HIV for a number of reasons. It's a simple test, and they can know the results in just 5 minutes.
For me, it's very important to do an HIV test because we take care of our family and friends. Because if you don't know, how would you know if you're infecting a loved one?
It's important because one never knows what's going on with their partner or ex-partner.
HIV/AIDS is both treatable and preventable. People who have the virus can live normal lives as long as they stay on treatment. In most segments of U.S. society, the number of AIDS cases has gone down, according to the Centers for Disease Control's director, Dr. Tom Frieden. Frieden spoke to VOA by Skype.
We've seen huge decreases in heterosexual transmission, more than 2/3, 80% reductions generally. We've seen huge decreases in injection drug use as a cause of transmission. But among young men who have sex with men, we've seen increases in HIV infection.
Groups that are most at risk are Hispanics and African Americans.
Women of childbearing age and young Black, gay, and bisexual men seem to be most at risk for HIV and for new cases of HIV infection. And then when we look at who progresses from HIV onto AIDS, again, Blacks and Latinos are most at risk for that.
NovaSalud teaches people how to avoid getting HIV/AIDS, and it helps those who have it.
The first thing we do is we acknowledge that there is stigma.
Stigma gets in the way of treatment everywhere in the world. Experts say testing has to become routine.
If you go to the doctor to get your blood work for cholesterol, for high blood pressure, why not start including HIV and STDs?
The goal everywhere is to get to the point where 90% of those with HIV know it, and 90% of those who are positive get treatment, and finally, 90% of those in treatment reduce the virus in their blood to undetectable levels. The theory is that this will end the AIDS epidemic as a global public health threat by 2030. Carol Pearson, VOA News, Washington.